read the injunction. She's asking for moving money. The car down payment is all. A plus for effort. Yeah.
I've seen his name. I wasn't knowing I was talking to him.
So yeah, but I would stay away. That's what she said. It's not, I appreciate you having your schedule. It helps.
I won't sit down.
No, I thought I was told to be somewhere at 1:30 tomorrow.
But it was a regular schedule. And so long.
Well, the only one that's gonna be tied, both of them tied, so we moved.
Yeah. Good. That's from the side. I was put out, but it was great. Everyone. I'm doing good.
Good evening, everyone. Welcome to the Lakeshore Hospital Authority workshop. Carl, is this okay? We're on. My name is Mike McKee, and I'm going to be the moderator for this evening's program. The purpose of the workshop is to give the authority the opportunity to make a presentation on efforts to date to utilize Lakeshore Hospital's campus. A presentation will be followed by one from Meridian explaining their need for the hospital facility and their intended use. After the above presentations, an opportunity will be given to allow those persons in attendance and those attending remotely to prepare written questions as we will read those into the record. The intent is to have either a representative from the authority or for Meridian to answer those questions. To be understood tonight, this is a workshop. This is not a meeting. No direct verbal comment will be allowed. This is an opportunity for those in attendance in person and remotely to create an understanding of what is being proposed and to provide an opportunity for questions to be asked that will further assist in this understanding. Public verbal comment will be accepted at a special meeting of the authority scheduled for February 7th, same time and same location. Which will be subject to the authority's meeting rules. The workshop is going to be 2 hours long, and I'm going to turn it over to the authority director, Dale Williams.
Thank you, Mike. Thank you to those in attendance, both in person and remotely. My name is Dale Williams. I'm the executive director of the Lakeshore Hospital Authority. I do not intend to spend a lot of time recapping the authority and who we are and what we do, but I did want to just make a few things or make a few comments regarding the authority. First slide, please. Sit anywhere you want. First slide. Technical difficulties. It happens. Okay, while we're waiting on the IT people to fix whatever glitch we have in the slides, let me go ahead and begin. The Lakeshore Hospital Authority is an independent special district. Independent special districts are defined by state law. As an independent district, the hospital authority has broad powers. I won't go through all of those powers, but certainly they have the powers to provide hospital services, and they can do that through ownership, lease, or contract. They also have the power to furnish temporary relief to indigents, and they have the authority to levy taxes. While they have the authority to levy taxes, to my knowledge, in the whole history of the authority, never levied the maximum millage. And in fact, the past 3 years, they have not levied a millage except for a millage that basically preserved the Lakeshore Hospital Authority as a taxing unit on the tax bill. The millage they actually levied was 1/10,000th of 1 mil. So while they have some powers, it does not mean that they must use them in all cases. They're governed by a 7-member board of trustees who are appointed by the governor. They serve at the pleasure of the governor, and they serve without compensation. The 7-member board currently has 4 members appointed. There are 3 vacancies. So that's the current status. From the period of April 1st of 87 through September 30th of 2020, the Lakeshore Hospital Authority leased Lakeshore Hospital to 3 different healthcare companies. For those of you that have been residents of Columbia County for any length of time, those would have been Santa Fe Healthcare, Shands Healthcare, and Community Health Systems. The last of these healthcare companies, Community Health Systems, gave verbal notice on May 6th of 2020 that they would cease hospital operations on September 30th of the same year. The reason cited for closure was non-profitability, and of course the hospital has remained without a tenant since that period of time. The identified issues that we found in finding a new hospital tenant included, but was not limited to, profitability of previous operators and building standards, and those are the standards set by state law, primarily AHCA, the Agency for Healthcare Administration, that were required to keep the building open as a hospital. Nonetheless, we did gauge interest in Lakeshore by visiting several operating groups. These are medical operating groups. However, we were not successful in finding a new tenant for the provision of hospital services. So as we did not find a new hospital operator, we issued a request for proposals, statements of interest. We'll hear us sometimes refer to this as the first offer. We wanted to determine what providers may have been interested in utilizing the hospital. We received responses to that RFP on August the 3rd of 2020, and we grouped those responses into 2 categories: those that provided medical services, those that did not. We did try to place an emphasis on those that provided medical services over those that did not. While we were in the process of vetting responses to the first offer, we were interrupted, as was much of the world, by COVID-19. And in addition to that, for the period of July 5th, 2021 through November 5th, 2021, we did not have a quorum of appointed members on the Board of Trustees. So basically, for that period of time, we had no way to conduct business. Once we received a gubernatorial appointment and we had a board that had a quorum. There had been so much time elapsed since the responses to the first proposal had been received that it was decided that we should reject those and have a second offer. The main reason for the rejection was over that period of time, a lot of the initial respondents were calling, they were wanting to change their proposal. They were wanting to add. We had other people who were now wanting to submit. There was a number of things. And so it was determined to be best to just set the first offer aside and have a second offer. We did so, and those were received on February the 22nd of 2022. Meridian actually responded to both the first and second offers, so they have been primary respondents to both of these requests. After we vetted the second offer, for various reasons, various proposers were eliminated. There was a list. I won't belabor the point as to why. Some were very good and would have made good tenants, but for one reason or another, they did not fit the ability of the authority to accommodate. So once it all filtered out, we pretty much ended up with one response to vet and consider. And of course, that one is Meridian, which we'll present later. In determining the end user of Lakeshore, there's a few things that we think it's important that you remember. One is we do not get to make up the rules as we go. The authority is an independent special district, therefore they're bound by the requirements of law. So what's important here in making our decision is, do we meet the legal requirements of law? Do we meet the needs of the community? Those are the things that I think at our next meeting, the trustees will be looking at and making their decision. We also have to consider the financial resources that the end user has or does not have. The hospital building's huge. It's 125,000 square foot. It's not an easy overhead for just an average business to come in and be successful, be able to accommodate. It takes a lot of money to operate the hospital. So for the most part, you're looking at end users which occupy the entire building. Right now, you as taxpayers are spending about $50,000 a month on average just to keep the building open. It's very expensive, and it's not unimportant to not realize that. It's also important to note some other things. In addition to us maintaining the minimum standards of operation, there is a legal issue as it applies to the authority and their ownership of the property. There is a reverter clause in a 1955 deed that would affect at some point what the authority can do with the property. So regardless of what may be decided by the authority board, there's still the need in order to cure any legal issue that may exist with the deed if we should get that far. So I think it's important that we mention that. Now, just like Meridian, I'll be happy to answer at the appropriate time any questions you may have about the authority's role, the authority's intent at the appropriate time. Mike?
Okay. Thank you very much. And now we're going to hear a presentation from Meridian. The leader of this presentation will be Lauren Cohn.
Good evening, everyone. Thank you. Going to give them a second just to get our presentation up. And here we go. Go ahead and go to the next slide, please. Okay. Well, I'll go ahead and do some introductions while we're waiting for that to load. As Mike said, I thank you for the introduction. I am Lauren Cohn, the Executive Vice President, Chief Operating Officer for Meridian. With me, I have two wonderful individuals. First, Richard Anderson, our Senior Vice President, Chief Clinical Officer. Richard has over 40 years of dedication to Meridian, providing and overseeing a full continuum of services, a certified addictions prevention or professional master's degree in rehabilitation counseling. And there's not much at Meridian that Richard doesn't do or hasn't done at some point in his 40 years. So we're very lucky to have Richard with us. We also have Dr. Tony Werner. Dr. Werner is double board certified by the American Board of Psychiatry and Neurology, a member of the Florida Psychiatric Society, sits on a couple committees there, and was the past president of the North Central Florida chapter. Dr. Werner is our Chief Medical Officer. So we're going to be facilitating the presentation as well as responding to some of the questions submitted. So first, I'll start off with a little bit about Meridian. We've been providing services in North Central Florida since 1971. We are celebrating our 50th anniversary. Right now, we have over 50 years of operations and continue to grow in meeting the needs of our communities. The graph there, the graphic shows kind of the full continuum of services offered by Meridian, from the prevention, homeless recovery services, all the way to the more intense inpatient crisis stabilization, which we'll kind of talk about a little bit about today. We use evidence-based practices to provide treatment for mental illness and substance use disorders. We also address social determinants that impact that healthcare, housing, employment, and medical care. We currently have offices in 13 counties and provide services to residents from most all of Florida. Outreach and treatment services touch over 36,000 individuals annually with over 400,000 services. For last year, our expenditures were over 55 million, and we employ about 650 individuals from across the region. For licensing and accreditation, where to begin? We have a ton of licenses, and that's an official number. We have 55 substance abuse licenses by the Department of Children and Families. We have 7 licenses for the Agency for Healthcare Administration, Crisis Stabilization Unit, Residential Treatment, and Healthcare Clinics. We are accredited by the Commission on Accreditation for Rehabilitation Facilities, also known as CARF. So we have a lot of oversight and monitoring as a part of all of these licenses. So we were eager to skip to the next one. Go on. For community needs, when we talk about the needs of Columbia County, in 2017, according to a needs assessment done by Well Florida, Columbia County residents visited emergency rooms for mental health reasons at higher rates than those for the state as a whole. According to Mental Health America, nearly 2.9 million Florida adults, about 17% of the population, have some form of mental illness. The last 2 years have led to an increase in people seeking help for mental illness, particularly anxiety and depression. I'm sure I don't need to sit here and tell you the needs of the community. We have seen much greater rates needing mental health and substance use treatment, particularly in the last 2 years, but overall an increase steadily each year. Thanks. So currently, we serve as a central receiving facility in this county. We have a campus on Michigan Avenue, and we have a crisis stabilization unit there that's serving as the receiving facility for this county. We plan to expand that model into our Alachua County campus. In 2022, we opened a 16-bed residential facility called Williams Manor by Meridian. And we provide residential treatment to individuals with mental health issues needing a stable placement so they can access services and remain in the community. That facility was in response to a growing need in the community. We identified that need and were able to meet that in one of our existing facilities. We also have primary care services. Again, based on a needs assessment in Columbia County, we found that that was a need that wasn't being fully met in this county. So we were able to open a primary care clinic at our current campus. We continue to expand that. Right now, we're providing those services to Meridian clients, but we're looking forward to growing that and meeting the needs of the general population. So this is a snapshot of the services we provided in 2022. I know this is a lot of data we're throwing at you right now, but I think just to give you an idea of how many individuals and services we provided over the last calendar year, and we look at in acute care, we've got 635. So we're going to talk about kind of impact that this program would bring in relation to acute care, residential treatment, and hospital level. This is some information on our client satisfaction. We provide a lot of services, so we're telling you a lot about what we do. It's not enough that we provide those services, but we want to know, are those services making a difference? Are they moving the needle? Are they improving the lives of the individuals that we're serving? So what we've seen is 75% in both adults and children exhibiting an improved functioning and a reduction of symptoms. And that's really what we're looking at, the benefit and the effectiveness of the services we're providing. And then would people return to our services? Would they recommend those services? So we're seeing over 95% saying they would return to Meridian if they were experiencing that need in the future. So Meridian at Lakeshore, that is kind of the name that we're going with for this presentation to kind of encompass the location and the community there. It is approximately 117,000 square feet of planned space, and we have detailed plans that will go through for each floor in using that entire space. What we've planned is for inpatient and residential care for clients with different levels of acuity. What that means is different needs. Folks that are experiencing a crisis, folks that are in need of primary care, folks that are in need of residential treatment. We've got plans for all of that. We plan on using the hospital building and the surrounding grounds offered at Lakeshore to expand the continuum of care that the community is experiencing. We'll talk a little bit about this, but our campus right now is full. It is full to the max. We've got people working out of closets and the need continues to grow. There are some needs that are currently not being met in this community that we want to meet, and this plan includes details on how we can do that. So we've outlined staffing as well as an operational plan for the foreseeable future. We don't have any limitations or restrictions from complying with this process as we go through it. So let's move to kind of the plans for the building. I think that's the nuts and bolts of what that looks like. On the first floor, there is a large staff and visitor cafeteria and patient kitchen. But for us, the big plan here is the emergency crisis stabilization unit and our psychiatric emergency receiving facility. This would include the services that we currently have on our Michigan Avenue, not all of them, but just the crisis stabilization unit. We currently have a 28-bed facility on our campus, and we are full at all times, as Dr. Werner, I'm sure can tell you, because she spends almost every day of her life there on that unit. So that need, this space would allow us to be able to meet that existing need in a more effective and efficient way. The receiving facility would give us space not only to accommodate walk-ins and families and individuals in crisis, but also law enforcement and Baker Act and Marchman Act individuals coming there. We've also included a plan here for a pharmacy. We don't currently operate a pharmacy, but we would love to partner with a community pharmacy. In some of our locations, we have a pharmacy that we partner with, and it's hugely successful. It allows for much easier access to medication as well as better compliance. We've also included space for Lakeshore Hospital Authority offices. What we would love to see is a partnership there where we've got a representative of the authority to be able to access that process and funding to allow folks to get treatment and get primary care services. We've included a space for primary care here. While we currently provide primary care and are happy to do that, we also are open to the idea of partnering with a local primary care clinic or a provider who would be interested in doing so. We can certainly bring our primary care clinic over, but if partnership is an option or there's a community provider interested, we welcome that as well. So the first floor, phase one, a psychiatric and addictions crisis. So like I said, we would be moving our crisis stabilization unit, which is currently 28 beds, from our Michigan Avenue campus. But we would also be doing addictions crisis receiving, Baker Act, Marchman Act receiving, and the average length of stay for those programs, the crisis is just triage, emergency assessment, getting folks where they need to be, providing them with resources if they don't need to be in an inpatient facility, mitigating that crisis by providing them resources in connection with a program that would meet their needs. Our crisis stabilization unit is an average length of stay of 3.5 days. So it's just that, trying to stabilize a crisis to get folks to be able to back to the community or to a placement and treatment that will be kind of assisting them in their recovery journey. The first floor also, phase two, would be the addictions receiving unit. This would be a completely new level of care for the community. Currently, we have an addictions receiving facility in our Gainesville campus. This is not a need that's being met right now in the community. We receive individuals at our Michigan Avenue campus for addictions receiving, but unfortunately, we have to transport them to our Gainesville campus to receive that treatment. We receive a lot of individuals in our Lake City location and have to remove them from the community and often their loved ones and their support network who are maybe not always able to make the drive to Gainesville to continue to participate in that treatment. The average length of stay for that program is 5 days. And as I mentioned, primary care and pharmacies. The second floor, our plans include a short-term residential treatment, as well as forensic beds and counseling offices. So we'll talk a little bit more about what that looks like. A short-term residential treatment is about 16 to 20 beds, where the average length of stay is 3 months. This would be a new program, again, meeting the needs, adult inpatient, providing services to individuals, a high level of care for those no longer experiencing some type of psychiatric emergency, but they're still in need of ongoing treatment in order to make their transition back to the community successful. For the forensic residential treatment, that would be about 30 beds. This would be for individuals involved in the judicial system. It's a less restrictive environment. It is not a state hospital, but it assists folks with getting the treatment and supports that they need in order to safely and successfully return to the community. That average length of stay is about 6 months. The third floor would be an inpatient psychiatric suite. This would be a psychiatric hospital level, which again, we do not currently have. We'll talk a little bit more about that. And then the fourth floor would be mobile response team, community action team, administrative offices, lots of support services that we currently have in place at other locations. But this location would be allow them to better respond quickly, efficiently, effectively to respond to this community needs. If you would go to the next one. I just want to touch on something because I think the slide wasn't there. The psychiatric hospital level of care is currently a need that is also not being met in the community. At this time, individuals that require a psychiatric hospital level, unfortunately, have to be sent out of county. And often that is either Gainesville, Tallahassee, Jacksonville. We have had to send folks as far as Brooksville to receive that level of care. And that removal from the community and their supports can often be very detrimental to their recovery. We have families, supports, loved ones who would love to be able to participate in that recovery and unfortunately are not able to travel to these long distance locations every day, every other day as it would require. So unfortunately, folks are having to leave their community and leave this support network to receive the treatment and come back. So the need for Meridian at Lakeshore, as we mentioned, there is a huge growing need. The population is growing. With that growth comes an increase in demand for all of the behavioral health services that we offer. Just to give you some details, 1 in 5 people are affected by mental illness in their lifetime. 1 in 9 people are impacted by substance use. For Columbia County, that means about 14,000 individuals in need of mental health services and almost 8,000 individuals in need of substance use services. I'm sure, everyone sees the news articles and sees what's going on in mental health, and suicide rates nationally are on the rise. They're on the rise for adults and they're on the rise for children. Based on the available data, rates in Columbia County are rising as well. These services and being able to offer more are doing what we can to address that need and reduce those rates. Do you want to add something? Maybe like you want to add something? No. Okay. So Columbia County residents needing inpatient treatment, as we mentioned, often have to go out of the area, which creates additional barriers in accessing services and additional challenges in allowing family to support them and participate in that recovery process. So what this looks like, we've gotten a lot of questions. 2 campuses, what does that look like? What's coming over to Lakeshore at Meridian? What would stay? How does that plan address our current campus? So I kind of want to break that down. The services that we intend on bringing to Meridian at Lakeshore would be the crisis emergency screening currently on the existing campus. And I will tell you, when we talk about our campus being full, our emergency screening area is the fullest. It is a tiny area. And if more than 3 people show up at once, it's full. So this area would allow us to be able to have a safe, secure waiting area for individuals and families needing services. Our crisis stabilization unit, which is currently on our existing campus, would come over to Meridian at Lakeshore. Addictions receiving facility, which would be a new level of care for this community. Short-term residential and psychiatric hospital, also a new level of care for this community. Residential treatment. While we operate 2 residential facilities on Michigan Avenue, those would stay. Our Williams Manor facility and our youth residential facility recovery center would stay where they are at. The new residential treatment would be the ones we discussed, the short-term residential and the forensic residential. Mobile response team and our community action teams, both of those are currently on our existing campus. The majority of the services they provide are in the community. They're in clients' homes, they're in schools, they're responding to needs. We would bring them over to Meridian at Lakeshore to be able to respond to the need quicker and to be able to assist with clients transitioning out of our inpatient unit into the community. It would just allow for more efficient access. The services that we intend on keeping at Michigan Avenue, medication-assisted treatment. That is a big question that we get. Our medication-assisted treatment program has a great location that is very busy and in demand on Michigan. We have no intention of bringing that over. In fact, this would allow us to continue to grow and expand by using some of the existing space that's being occupied by these other programs. And our outpatient clinic would also stay on the campus that on Michigan Avenue. We want to make sure that we're letting everyone know that the Lakeshore, Meridian at Lakeshore would be a hospital level of care, an inpatient hospital facility. So also to kind of provide some additional information and respond to some of the questions that we've received, not tonight, but in advance of this. Meridian at Lakeshore will not be a state hospital. We will continue to refer clients to the state hospital. We partner with the state hospital in transitioning individuals. And while they may have to wait in our facility for a brief period of time, this is not a state hospital facility. We will be providing for 24/7 security at Meridian at Lakeshore, as well as a 24/7 triage and screening walk-in to allow folks to be able to access care when they need it. Often crisis does not occur during the day from 9 to 5. If only it were that easy, then we would be able to operate so smoothly. But crisis occurs at all times, and we want to make sure that just as individuals would be accessing a hospital when they have an injury in the middle of the night, they would be accessing our facility when they have a mental health crisis at any time of day. We've gotten a lot of questions as to what it looks like when folks leave our facility. Will people be hanging out? Will we be, for lack of a better term, opening the door and they're sleeping on our campus? That is not how our services work. Everyone that leaves our facility has a coordinated discharge. We provide transportation to home or permanent living when needed. We coordinate with families and supportive services and permanent placement to receive that individual and get them where they need to go. We have assigned discharge planners that assist in securing that placement and setting up step-down services so they can efficiently continue their recovery process with us. We collaborate with caregivers and families on that transition plan. What does that look like? Who's involved in their care, and how can we bring them in order to make sure that that discharge is as successful as it could be? We've also provided some studies to the hospital authority on the benefits of behavioral healthcare facilities to communities. And a couple of those studies show that local access, community access to behavioral healthcare, in fact, reduces crime in the community. That having that access to healthcare allows individuals to readily receive the treatment they need, which has a direct impact on crime reduction. So looking at some of the partnerships we've mentioned, I kind of just want to summarize the partnerships that we plan on including in Meridian at Lakeshore. Pharmacy, as we mentioned, we have pharmacy partnerships existing now in some of our facilities, which we would love to continue at Meridian at Lakeshore with either pharmacies we've partnered with in the past or new local community pharmacies. Primary care. Again, we are planning on bringing our primary care over, but if it works better for us to have a local primary care provider who is invested and wants to provide that service in the facility, we welcome that as well. Lakeshore Hospital Authority staff, we would love to have an office and location in the building so we can better partner in providing services to the community residents. We would love to have dental if possible. I put if possible because that's we don't know what that looks like yet, but it's on our wish list. I mean, I'm sure you know that a lot of the individuals served by Meridian, certainly, and just in the community are struggling to meet those needs. Dental is often something that is very difficult to meet. And then we've got Gateway College. Dr. Barrett was gracious enough to come and tour our campus. We currently have a memorandum of understanding with them in place now for us to collaborate and partner on student education. We work with them on placements when appropriate. We discussed the possibility of providing practicum and training for nurses, RNs and LPNs, as well as certified nursing assistants and certified medical assistants. We talked about having medical and para training programs. We would love to see what that looks like. We currently provide training for residents with the University of Central Florida as well as HCA, and we would love to expand that program to include Gateway College. So we had a discussion also regarding potential culinary training. That's a wonderfully large kitchen. We currently have dietary staff and we operate kitchens in both of our campus, but we would love to see that expand to have culinary training for that level of care. So all of that discussion has occurred, details to hopefully be worked out. So what the community impact looks like for Columbia County. Again, we've talked about providing levels of care that are not currently being provided, psychiatric care, addictions receiving. We also plan on bringing over 86 full-time employees from our current campus with plans to add an additional 98. That would bring a total of 184 positions for Meridian at Lakeshore, with over 250 for Columbia County. What that brings for this particular location is additional economic impact for the surrounding area. That means you've got 24/7 staffed units with staff going out for lunch, going out after work, spending time in the area from these professional jobs. We also would be providing a coordinated system of care with our wraparound teams that really follow an individual from admission to discharge, providing that care to that person through their whole recovery process, making sure that they're set up for success and connected with ongoing services that will continue to benefit them. So just to summarize, our collective goal is to better the health and well-being of the communities we serve, especially Columbia County, as we see and have talked about kind of the growing need. We don't see this opportunity or a similar opportunity presenting itself again. And these services that are life-saving may not be available to the degree that they're needed in the future if we are not able to secure a location and an expansion plan. So we ask for the opportunity to sit down and flesh out a plan that would be mutually beneficial for the members of the community. And that's our hope today, is that we provide you with the information and give you all of the details of what we intend to do and how this would benefit Columbia County, and answer the questions that may still be remaining. So I thank you so much for allowing us the time.
Thank you, Lauren. We're going to give people a couple minutes to write questions down. We've got some forms in the back of the room. If you have questions, bring them up here and I'll read them into the record. Yeah. You want to go? Couple. Yeah. Okay, well, you need to write them down. You need to write them down. Okay. Yeah, let's take a break while we write our questions down.
Okay. Okay, thank you.
Go ahead, you write it down.
Please.
Select question.
Yeah. It was put in the hospital. Or it was put in the veins. Amendment.
For those of you who are watching remotely and would like to ask a question, if you'll go to the chat button on Zoom and then select the question button and just type your question in on that Zoom question. And we'll get those submitted here as well.
Where's Carl? Who took Carl?
I never see.
Okay, if you have any more questions, please submit them here and we'll get started. Hopefully we can answer that and hopefully I could read your handwriting. Okay. First question comes from Barbara Lemley. Who says, I am in support of Meridian taking all property. The question goes to Meridian. Will Meridian assume all costs for all taking of all Lakeshore Hospital buildings? And I don't know, I'm assuming
Oh, yeah,
anybody can answer.
Dale, would you? Okay, yes, we would be assuming the cost of operating and taxes once we assume responsibility of the location, once we assume ownership.
That was easy. Okay, this is Sylvester Warren. There are several questions here. I'm going to do them all, but not at the same time. How is this facility going to help the Black community? Or, I mean, I direct it to either one.
I can answer that. I think it's going to help all communities and, you know, we don't discriminate against anyone. And so we take all comers, whether they're insured, uninsured or underinsured, irregardless of their race. So it would, having a second location in Lake City would make it more accessible to all races and all people.
Okay, this also goes to Meridian. How many jobs will this facility have or hire specifically out of the Black community?
Again, we can't discriminate, but we're gonna hire the best qualified individuals for the positions that we have available. Right now, we recruit all over the place for positions that we have open. And we would welcome qualified applicants to apply. And if you apply with the number of job openings that we're going to be creating, we would love to have a cross-cultural employment with our staff.
Okay, this, I guess, for Meridian. Why put this facility in a community that doesn't want Meridian there?
I would say that we're already here. Those people are just being moved from that location or that area to our campus where it's located now. But we're already here in Lake City. It makes it more accessible. And if these people can get better treatment, we'll get them off the streets and you'll see them, you know, less, we'll get them better help. It'll give us the opportunity to have them have better access and for us to provide better care for them.
And for me, it's not just being a part of some place that people don't want you. We want to make sure that we have made ourselves available to provide services to people who need the services that we're trying to offer. So we are bypassing whether or not we're wanted or not. We know that there are a lot of people out there who want the services, who need the services, and that's really who we're really trying to serve, those individuals who are in need.
If I could too, I would hope that even individuals who may be skeptical about it in the beginning would see the benefit that we bring to the community and see people getting better and their lives positively impacted, and potentially dispel some of the myths or ideas that they originally had and would see the value.
And I think we really want to work with everybody, and we want to be a welcome partner in the community and in every neighborhood. And that's our goal, to be great stewards wherever we are.
Okay, and I think this is a statement, may support the idea, but wrong location. Wouldn't this facility ruin the future for what may want to see in that area? Dale?
Well, the only thing I can add to that question is when you go visit these facilities and other locations, it doesn't appear that there's been any diminishing of development that occurred in and around these facilities. In fact, in some cases, it actually enhanced or created economic opportunities off the campus. Now, obviously, we're not as big of a campus, or this is not as big of a campus as maybe Alachua and some other places, but I think if you go visit, you do notice that. I think you do notice that. So there'll be a number of things that the trustees will have to consider in making their decision. But I would say that probably the evidence would support that they do not disenfranchise other businesses. They seem to actually attract some economic activity.
Next question from the same person. What about the increase of drug addicts in a heavy drug area already?
I feel like I'm answering all of them. Yeah, so our medication assisted treatment programs would remain at the other campus. This campus would allow us to have beds for an addiction receiving facility. So those people under a Marchman Act are seeking inpatient treatment, and also some rehabilitation beds. So hopefully we would be moving those people and offering them treatment, making it readily available to them, having more beds and not having to move them out of county and getting them off of the streets.
And again, it's inpatient locked hospital level care. So it is not the type of facility that folks are coming in and out of, wandering around.
Right. If you
Right.
drive by our Michigan Street campus, there are not people hanging outside of our buildings. They're not out there. They're not in our parking lot. So I know that's kind of what you're imagining, but it's not what we have at our facility.
And I think during Lauren's discussion, she talked about us having discharge planners and ensuring that we're discharging people properly. And so we're ensuring that these individuals are placed appropriately someplace else when it's time for their discharge. So they should not be loitering around anywhere.
Why not put it on West 90 where all the, not sure what the word is, are located? Amenities.
I think for us, we have talked about the difficulty in securing facilities and the opportunities that don't present themselves and the lack of opportunities for expansion in other facilities. So we're doing our best to appeal in this opportunity now, but it is not as though we can put facilities, I think, anywhere we want at any moment. So I think that's not a viable opportunity at this time, but we're talking about this opportunity. We're appealing for this present facility to be able to expand and meet the needs of the community using this location. I think that's what we're focused on.
Last question from Sylvester Warren. Where were you guys during the crack epidemic when blacks were going to prison rather than treatment?
No, I think for us, we have a lot of programs and services devoted to diversion and recovery. I'm not, we can expand on those certainly, but we are focused on getting people out of incarceration and getting people to the treatment that they, we've got mental health court, specialty courts. I mean, that's a huge focus for us at the present time.
And I was around during the crack epidemic, and you can only do so much as funding allows you to be able to do. And at the time of the crack epidemic, we did not and still don't really have a substance use disorder program here in Columbia County. We had the program in Gainesville and Alachua County, and we provided those services to those individuals who came into the program. As a matter of fact, we expanded the substance abuse programs by being inclusive with operating what we call the Sid Martin Bridge House there in Gainesville to accommodate those additional people who were suffering with crack addiction at the time. And also we expanded the opportunity for those individuals to be in our detox center. We were calling it a detox center at the time. So I think one of the opportunities we have here is to be able to provide those services locally and be ready for the next epidemic, which most of you all understand right now is happening with fentanyl and those kinds of things. So we're really trying to help people right where they are. And I think this gives us an opportunity to do that.
Okay, our next question comes from Joshua Garner. Actually, a couple questions. Can you dive into the reviews on Google? I understand a rehab may have a negative slant, but when compared to other rehabilitation centers, ? Patients and employees alike seem to have a common tone. I'm not sure what the Google reviews are. You probably do.
Yeah, I think that if you take into account that the majority of our clients are not brought to us voluntarily, they're brought there involuntarily. That does put a slant on it, but I can assure you, we have very well educated and trained physicians. Myself and several others came from the University of Florida. I think all of ours did. I was actually the vice chairman of the Department of Psychiatry at UF and retired there after 18 and a half years and came to Meridian the next day. And several other faculty members came with me. So we have very dedicated and well-educated and trained faculty, and we have very well trained staff. And, you know, if they didn't want to be there, they wouldn't be there. It's a tough job. So.
Next question. It's been stated several times, who can pick up and when with family or transfer to long-term care center in Gainesville? Can you explain more about that timeline and the possible discharge information that resulted in recent release of a patient in a violent attack on a local resident, which he swung and struck her with a bamboo stick on 6/26/21. More details can be provided for the next meeting. Not sure if anybody.
I don't have details on that information. I would not be able to comment. or
Yeah, I don't
respond
have
on that,
knowledge of that. It's been a year and a half ago,
Yeah.
so I don't have knowledge of that. incident.
unfortunately. I think as far as we talk about discharge plan, I can respond to the first part, certainly. When we talk about the discharge planning and the coordination, bringing people to a facility. So I think hopefully I'm answering the question. When we talk about folks coming to care facilities from Columbia County into Gainesville, we've got folks currently that are presenting with addictions needs. And so they're brought to our Lake City facility, and we coordinate their transport for treatment in our Alachua County facility. So this would allow them to continue to receive treatment in the county. We also talk about Medicare patients, and those individuals are needing psychiatric hospital level. So we would be coordinating that transfer perhaps to other care facilities in other counties, sometimes Alachua, sometimes, Jacksonville, Tallahassee, Orlando, Brooksville. So it depends on that. So those could be the two scenarios I think that we're talking about, with folks needing longer term care or additional care that's not available in these counties. So hopefully that answers the first part.
And I just like, as an add-on to that, I think if we're able to get this facility, then some of the things that we're planning to do there would most certainly address those kinds of issues, because you'd move people from one level to the next, and you have that in-house in that particular facility. So we should alleviate some of those kinds of things occurring.
Okay. Last question from Joshua Garner. Several years ago, there was information being distributed about a patient exiting the current Michigan Avenue facility and tragically ending his life by entering the roadway in front of a truck. Was this incident that occurred? And if so, what shortfalls happened and how have they been addressed?
Unfortunately, I don't have any information on that, and I wouldn't be able to respond to any particular specific, client situation. But I can tell you that we have dedicated, caring staff that do everything they can tirelessly day in and day out to provide individuals with the service and care that they need. As Dr. Werner mentioned, it's a tough job, and they do it day in and day out. We've got one of our counselors here today who tirelessly works to make sure that folks are receiving the care and treatment that they need, not only when they're in our facility, but when they're discharged. So we can set them up and hope that their recovery journey continues with us or with another provider to be able to continue to live their lives. So that's kind of hopefully all I can say.
Next question is from Chase Moses. What safety procedures will be in place for the public when patients are released?
Again, the majority of our patients, and I would say 99.9% of them are not from right around the hospital. And so when they leave our facility, we transport them. We have vans and cars. We transport them. Their family is brought to pick them up, but we don't open the door and say, okay, you're free to go, and just let them out the front door. There's a discharge plan in place and a location of where they're going. We have an address, and we make sure that they're transported to that location. They're not just open the door and let them out. So they wouldn't be open the door and let them out from this facility either.
I think just to add to that, we've done some tours lately, some of the Board of Trustees members and some additional community members. And I think some of the comments we've received from individuals on our tour that go through our campus is surprising. Oh, there aren't a lot of people loitering, for lack of a better term, or hanging out, or just sitting on the campus. I mean, people that are on our campus are there for help or receiving treatment, engaged in treatment. And as we mentioned, we don't open the door and let folks out. We are coordinating that discharge, getting folks where they need to go, getting them to their permanent placement, getting them to their family. We have people coming to pick them up, participating in family sessions. So it is not something that is going to increase the individuals. I encourage you to drive by our Michigan Avenue campus because this level of care is already happening there. Our crisis stabilization unit is on that campus. And when you go to that campus, not see people sleeping on the curb, as some questions and comments I've received, or just out, not having anywhere to go. So I think that the safety consideration, we do intend on having security 24/7 at the facility. But I want to emphasize more the element of folks not just walking out the front door and going on their way.
Next question from Chase Moses. What level of due diligence has been performed to access or assess the mechanical and structural components of the facility? I don't know whether that's you or.
Anyone who submitted a response to the RFP were responsible for their own individual assessment. We, as an authority, provided any historical data that we had about the facility, but we did not, and we did this specifically, we did not tell any end user or prospective end user what they should or should not do with the building if they were to control it. So I do know that Meridian had a team of people who've looked at it over a period of time. I personally don't have a clue what they may have told Meridian that they would have to do in order to make the building ready. Likewise, when Florida Gateway looked at the building, they had their own independent assessment. When some of the other medical providers, they had their own assessment. When we were looking at using it as a VA treatment facility, they had an assessment. And I assume that all of them have similarities, but I also assume that all of them have differences. So I can't be specific, but Meridian would be responsible for their own evaluation and assessment of what the need in order to make ready would be.
And as Dale mentioned, we did hire an engineer and architect to come in and do a preliminary assessment on the facility, and we do have that report.
Last question for Mr. Moses. The need for the services is real, but is this the right location?
Again, I think we think it is. We certainly believe it is. That's why we're here today and have continued to be here and presenting our plan and the impact and the benefits. So most definitely, we believe it is. Certainly, I think when we look at building new locations, if we were to build a location or build a facility such as this in a new location, you're talking $30 to $60 million, which is not at all feasible. So certainly the cost to bring this facility up to our licensing standards and codes is far more reasonable than that.
Next question is from Chris Candler. While I agree that the need is present in Columbia County, Lake City, my question centers on the impact this project may have on the central business district of Lake City. Currently have a burgeoning CBD, and I am unconvinced that locating a psychiatric hospital will not adversely impact business demand and or commercial traffic in Lake City. How many treatment facilities do you have in central business districts? And do you have any studies that relate to this impact on traffic and the events in the downtown area?
I don't have any, I mean, I'll be transparent. I don't have any studies with me right now. But certainly that's something that we could that we could look into, or that we could look into further. And we believe that the impact would be positive on the businesses. I don't have any data or studies that show adverse impact. But I don't have anything with me tonight, unfortunately.
Okay. Next question is from Stephen Douglas. Is Meridian prepared to spend the millions, in parentheses, it takes to revamp the hospital to a serviceable hospital grade facility?
Yes. However, I do want to note that the standards for hospital and psychiatric hospital and the facilities that we would be operating are a little bit different. We are certainly not intending on providing X-ray machines and MRIs and those types of things out of the facility. So there would be a lessening impact on what it would take to become operational and licensed for our needs. Those needs would be different than a medical hospital. So I want to make sure and kind of distinguish that we are prepared for the investment it would take in order to get it operational and licensed for our use. And I would like to go back to the business only because now we're thinking here. And while I did not have a study with me, we do have several partners that we collaborate with that operate these types of facilities and hospitals in very metropolitan business, heavy traffic areas. So certainly they have not seen a decrease in businesses or impact on traffic otherwise in those areas. We've got a partner in Tampa who has done something very similar, and there has not been an impact in those surrounding areas for traffic. They're right near a school, right near a more business district.
Thank you. And this is from Mr. Lilker. How many people, it's for either Lakeshore Hospital Authority or Meridian, how many people have you heard from in District 10 that are against locating Meridian at this vacated hospital?
I would suggest a dozen, maybe total, from just me. That's my perspective.
I haven't heard from anyone, if I'm being honest, but that's not entirely surprising, I suppose.
Sonia, do we have any questions online? No questions? That wraps the questions up. Thank you all for participating in this evening's workshop. Thank you for your presentation. Our next meeting will be on February the 7th. The purpose of this meeting is to make a decision
hopefully.
hopefully, about this, utilizing some of the information that has been gathered here this evening. At that meeting, regular rules of the authority will be in place. This meeting is at this location, and it'll be at 6 p.m. on the 7th. With that, I close the workshop and thank everybody for coming.
Thank you.